Hi, my name is Noli Raz. It is January 2nd, 2018. Happy New Year. Starting a new class. This is for Module 1, a discussion assignment, introduce yourself video for Nursing 312. A little introduction. Again, my name is Noli Raz. I went to school at Golden West College. I graduated in 2006. I've been a nurse now for almost 12 years. I started out in med-surg. I worked in med-surg for about a year and a half. And then I got recruited to be a research nurse with an internist. So I started training with a nurse practitioner to be a research nurse. I worked with him in testing for 9 years as a phase 1 through 4 research RN coordinator, conducting pharmaceutical trials. I did that for 9 years. I did trials for hypertension, diabetes, psoriasis, osteoarthritis, kidney disease, heart failure. I did many trials and worked on many protocols for many diseases. After 9 years, I kind of switched gears. I started working as an infusion nurse with an infectious disease doctor for about a year and a half. So I started helping patients with infectious disease and did IV infusions, set them up on pumps for IV antibiotics. I did that for about a year and a half. Then I went back into research. I wanted to try different areas, so I started doing neuropsych research. I did in-house trials, phase 1 through 4 neuropsych trials. So patients with schizophrenia, bipolar disorder, depression. We were testing new medications for neuropsych disorders. And I did that for 3 years. At that time also, I did get hired on to the local jail, Santa Ana Jail. I was a jail nurse. I did work in intake, and I also worked there during that time. So after neuropsych, I got approached by a nurse manager over at St. Jude, and they offered me a position to do oncology research. So I switched gears this last year. I started up at St. Jude Medical Center doing oncology research back in March, and I've been doing oncology research for the last year. One thing I do love about research, not only in any comorbidity or chronic disease, is that we're finding new treatments for these diseases, better treatments, and that's why we do clinical trials. It's very important to not waste time giving medications that don't work. That's why we do clinical trials, to make treatments better in a shorter period of time. That's why we do research. And I love it. I know cancer is very complex, a complexity not only just because of the medications and the chemos and the targeted therapy and everything that goes on in oncology, but also just the dynamic of patients that are terminally ill. So it's difficult. So one of my hobbies, or what I like to do in my spare time, is play with my 2 twin boys that are 9, going to be turning 10 here in about 2 weeks. Just getting them to school and playing with them and doing boy things. So it's nice. That's what I do. And work and then play. I do have weekends off, so it does help that I have weekends off to have family time. What brought me back to get my BSN? Well, this is my last class, my last 8-week course in this BSN program. So what brought me back is my work. When I joined St. Jude, they require a BSN. So, and I knew that it was inevitable. I mean, I've already been a nurse for 12 years. So I started about 2 years ago here at San Marcos in 2016. So it was inevitable, and was just the right time. The boys were older, and I had the time to do it. What are my long-term education goals? Well, since I started this program, I just want to keep going. I don't want to stop. I just want to keep going. So I have looked into the next step to continue my education with getting my master's degree. So that is what I'm going to do next, is get my MSN. What do I hope to get out of this course? I do want to, refresh, learn, reinforce different medications and their functions and what they do, and so I'm very I'm glad I'm taking this class again, because I need a refresh and I want to learn about new medications and what this class has to offer about new medications and the pharmacology of it, and how I could definitely use this in my nursing moving forward. Again, my name is Noli Raz. I'm looking forward to working with you guys as a team, and thank you very much.